Dr. Richardson, I have a question for you. You started talking about it in your talk, and I'm wondering if you can elaborate as a clinician what we know about safety and efficacy in people with autoimmune diseases. People are also curious about kids, pregnant and lactating folks getting the vaccines. I know that's a lot of a lot of things at once, but if you could give us some insights, that'd be great.
Yeah, so I'll try and break it down. This is a very common question I've had in vaccinating many people. So let's start with people who are pregnant or people who are breastfeeding. So for those who are pregnant, the Society of Obstetrics and Gynecology is clear that this should be a decision that's made between a provider and a patient. The only reason for that is that the trials initially did not include women who were pregnant. In fact, in those early trials, we actually, when you look at the control group versus the group who got the trial, there were subsequently women who turned out to be pregnant. They didn't know that they were, and the rate of miscarriage actually was much higher in the control group. So what the Society of Obstetrics and Gynecology is saying is weigh your individual risk. One of the problems that subsequently emerged is it turns out women who are pregnant, although rare, are more likely to get severe disease with COVID that requires hospitalization. And when you have severe disease, that also leads to problems for the fetus, including preeclampsia, preterm labor, etc. So what we're seeing is that many women are actually choosing, based on their individual risk, to have the vaccine, and we will see that trial data coming out soon because those women, we are following them. So the reason it has to be a nuanced conversation is just because they weren't included in the original trials. We actually there was a lot of big splash of news last week because we showed that the first baby who'd been born with antibodies. Yes. And theoretically, we know, or immunologists and maternal fetal medicine and obstetrical specialists were telling us that theoretically there was a benefit to baby of antibodies being passed through the breast milk. And looks like that is what is playing out. Those are preprint trials that, again, we will be seeing soon. So for lactating women, again, a discussion that you have to have with your provider, just because they weren't included in the original trials, but theoretically and now in vivo, we're starting to see benefit from that. For people who are immunosuppressed, people with stable, that is more a question of how effective will the vaccine be. This is not these are not live virus vaccines. This is not like measles, mumps, rubella, where you're getting a modified lightened form of a real virus. These are all viral vector or mRNA. So there is not a risk actually to developing a the COVID if you take the virus. It's more a question of how effective your immune response will be if you're immunosuppressed. And it's looking like we are certainly recommending vaccination for those who are immunosuppressed, apart from a very small subset of people who are maybe having in the midst of a stem cell transplant, for example, for leukemia. But discussion with your provider. We know that those of you who are immunosuppressed are high risk for severe COVID, and we are strongly encouraging it. Autoimmune disease, there's actually no contraindication, and again, higher risk when you have chronic illnesses. And was there one? Oh, and children. Yes. So currently, trials underway for the 14. We know that Pfizer was trialed for 16 and up. Moderna and the others trial for 18-year-olds and up. So we're really right now have the young adult teenage population that's being studied. We're expecting that data within probably the next 4 to 6 months. And it's more a question, and then the younger under 12. The reason that we're looking at special trials for kids, we believe the vaccines will be safe. As you know, tons of vaccines are used in kids. It's more about whether the dose needs to be modified and how effective. Sometimes children actually require higher doses to elicit an appropriate immune response, or sometimes lower.